So mummy makeover per se is not a treatment for stretch marks. Yeah, the form of anesthesia that I recommend for a mummy makeover is a general anesthesia where the patient goes to sleep. So you are comfortable while it's being done. I wouldn't advocate local anesthesia for mummy makeover, major procedures. I do think it's necessary to organize for help in the immediate post-operative period, especially for the first 1 or 2 weeks. It may be with your daily activities or with something like childcare. That helps during that period. So I think, yes, you do require some help afterwards. Well, if you plan to have more children, you can have a mummy makeover, but it is advisable, it is preferable for you to finish having all the children that you want to have before you have a mummy makeover. Remember, the hormonal effects of pregnancy will change the way the body looks. So you don't want to change the effects of the surgery. Otherwise, you may need to have it again at the end of the last pregnancy. What you expect during the consultation is that a qualified plastic surgeon I would normally take a history from you. That would include all your medical history, take everything, and the reason you want to have the surgery, the areas that you're concerned about. Then do a proper examination of you. Then have a management plan, and also be able to show you before and after pictures of patients. Usually, I'll send a letter to you. There'll be a clean-up period for you to think about it. It is not an emergency and decide. And I will always offer patients, and many surgeons do that, offer you the opportunity to come back for more chats at no extra cost to you, just to make sure that you digest the information and are happy to go ahead with procedure. With this kind of process, one would expect some kind of pain or discomfort after surgery, but we do give you painkillers. We don't want you to be in pain at all. We don't want you to be in pain, so you're made comfortable. There are financing options, and some clinics do that. Personally, I don't do that because I think the agreement should be between the patient and the company. I think it's important to state that this kind of surgery should be done when somebody's in debt or when somebody has a lot of financial constraints. Because when somebody's struggling financially, the threshold for dissatisfaction gets lowered a lot. So I think that's a necessary stress for somebody to have and then be having this kind of procedures. That would be my take on it, but it's personal. Other people have different takes on it. Many patients are able to drive from 3 weeks on after the surgery. But personally, you know how well you feel in your body. Sometimes people may get some advice from their own motor insurance company. But usually 3 weeks for most patients, they're able to drive. The aim is to reduce the dissatisfaction, not being satisfied in the first place. So on your part as a patient, you must have realistic expectations. Make sure you understand the pros and cons of the surgery, of all the procedures that you're planning to have. Openly communicate with your surgeon what you think. And even after the surgery, open communication is important. Most surgeons, if you're dissatisfied, will bring you back for consultation, explain to you if there are any potential solutions or revision if it is necessary. Sometimes it is not necessary, it's just a misunderstanding or an unrealistic expectation on the side of a patient. So this is important even before having the surgery, that expectations are right of what can be achieved. The length of the surgery depends on the number of procedures and the complexity. But usually for most mummy makeover procedures, it takes several hours. Most patients have at least 1 night stay in hospital or 2 nights stay in hospital. Again, it depends on the procedure and the number of procedures that the patient has. One of the ways to minimize the effects of the scarring from any procedure would be adhering to the post-operative instructions. What usually happens is that once the wounds have healed, you'll be advised on maybe things like massaging the scar, moisturizing cream to help the scar mature faster and become more supple and reduce the redness around the scar. Advice about sun exposure will be given, things like that. So adhering to post-operative instructions and it's important to help minimize the effects of the scarring. However, I think it's important to always state that the ultimate appearance of a scar cannot be guaranteed. I think it is reasonable to state that one should wait at least 6 months after childbirth to have a mummy makeover. But the other factors that may change is, for example, it depends breastfeeding. How long is the person breastfeeding for? These are the things to discuss with the plastic surgeon or your plastic surgeon before you go ahead. Breastfeeding is possible after a mommy makeover. Again, it depends on what the person has had. For example, it may be affected a bit, or maybe you require some support with cow's milk if somebody's had a breast reduction. That's why, again, I say it is preferable to have a mommy makeover when somebody has completed their family, or even if they haven't completed their family, to wait enough time, at least 6 months or more, after any pregnancy, depending on other factors like breastfeeding, before actually having some kind of surgery like that. You're asking what results can you realistically expect? Well, I would say, first of all, realistic expectations are important before you have this kind of procedure. That's sort of an unrealistic expectations. What does it lowers the threshold for somebody to become dissatisfied with any kind of surgical procedure. But you see, the thing is, when somebody has been pregnant, remember the effects of the hormones on the body. It's not only on the part that's been operated on, it's on the whole body. So it's important to have that in mind. Also see before and after pictures and set your expectations right and get a clarity about what a mommy makeover is. The best time to have a mommy makeover is when you've completed childbearing. So you know you're finished having all the children you want to have, and wait enough time after that, especially if you're breastfeeding, before you then have the mommy makeover. Yes, you can combine many procedures in mommy makeover. Mommy makeover typically involves multiple procedures. You can combine, but this will be discussed with your surgeon during the consultation. Now, the use of drains is a bit controversial, and it differs from practice to practice. Whether you have drains depends on the surgeon who does the surgery and the parts of the body that you've had. For example, in my practice, most times, if it is in the certain kinds of procedures on the breast, I don't use drains. Other kinds of procedures, I use drains. And then when it comes to drains, there are different kinds of drains that can be used. The ones that are connected to the bottle, and ones to just drain freely into some gauze. So these are things to be discussed during the consultation. Some kinds of again, tummy tuck, you don't use drains. Other kinds you use drains. So these are to be discussed. And make sure you're comfortable. At least you understand what you're going to have during the consultation. The post-operative instructions will depend on the procedures that you have. But usually, this is something I will advise somebody when I see them as well. Before they get discharged as well, this will be reinforced. I mean, we will normally advise about things about how to manage the wound, the support garments that the patient wears, attending the follow-up appointments, adhering to restrictions and activity initially. So these are the things that is part of the post-operative care. And even how about weights, whether you can lift weights, what kind of weights can you lift. That's why I actually say that following the surgery, getting some kind of help in the first 1 or 2 weeks is usually necessary. A mommy makeover will only deal with the stretch marks in the area of skin. For example, if a tummy tuck is part of the mommy makeover, you will only remove the stretch marks in the area of the skin that's removed with the tummy tuck, not anywhere else. For example, someone has stretch marks on other parts of the body, will remove it. Only that piece of skin that's been excised, and the stretch marks there will go. So mommy makeover per se is not a treatment for stretch marks. You will begin to see the results immediately. For example, if somebody has excess on the lower abdomen has been removed, they know that has gone. So you see results immediately. However, it takes some time, up to a few months to several months, for you to say this is what's going to look like. So results continue to improve over time. I think in summary, you see, pregnancy has a lot of, the hormonal effects of pregnancy are significant on a woman's body. It affects the whole body. And as I was saying, mom makeover really, as the word sounds, or the phrase sounds, is something aimed at restoring the woman's body to what it used to be before, focusing on the most bothersome aspects of the body. Many patients are very pleased with this, and that's why it's become such a popular procedure.